Hi everyone, so we will be talking about the politics of trans and non-binary healthcare discrimination. So the issue of access to quality healthcare where one cannot and is not discriminated against is highly prevalent in today's political environment in the US. However, this issue is further exacerbated for trans and gender nonconforming individuals. Trans and gender nonconforming individuals face significant barriers to accessing quality healthcare due to systemic discrimination, uninformed medical professionals, and harmful political policies. This may mean multiple things. Medical professionals could be denying gender-affirming care due to newly implemented policies that may put their jobs at risk. On the other hand, some might not understand the emotional, physical, and/or mental struggles that a gender nonconforming person may encounter. A study mentioned in an article of Science Direct states that 28% of transgender individuals have avoided healthcare because of the anticipated discrimination that they may face. There has always been a clear systemic problem that hinders people's ability to get proper health care, and politically, this has quickly become a polarized subject nationwide. So as I've stated before, there are many reasons why discrimination could occur. There's systemic biases, there's individual implicit biases, there's uninformed medical professionals, there's a lack of inclusive medical training, and harmful policies that are causing this disconnect in healthcare. First of all, trans and gender nonconforming healthcare can refer to a number of things, whether it's FFS, facial feminization surgery, top and bottom surgery, Botox injections, chest enlargement surgery, mental health resources, access to hormone treatments, and much, much more. This has become a very relevant topic, especially under the current administration in the US, where trans and non-binary rights to healthcare are under a constant attack. According to Rose Eigelson's article on the sexual healthcare experiences of non-binary young adults, healthcare-related gender and/or sexual identity discrimination creates the harsh and vast outcome of gender nonconforming individuals receiving lower than quality care and can later prevent GNC adults from returning to healthcare locations because of the same anticipation of discrimination occurring to them. Now, there are a handful of reasons why trans and gender nonconforming people are able to access quality healthcare. For one, medical professionals may have religious beliefs that they incorporate into their practices and are later turned into implicit biases during the course of treatments, etc. Under this relatively new and dangerous administration, too, several states have criminalized healthcare for medical professionals who diagnose, treat, and provide resources to trans individuals, and these medical professionals who do have and treat trans and GNC clients may be fined, sued, or thrown in jail for practicing it. Also, many teaching hospitals do not incorporate trans and GNC healthcare practices and/or anti-implicit bias training that may impact the overarching way in which doctors practice their medicine. According to Drew Burchell's journal, there have been an increasing number of institutional healthcare barriers, which include the subthemes of informational erasure, medical transition healthcare barriers, anticipated discrimination, and safety assessment. In the same journal, he also states that medical professionals will often include a binary narrative in their practice and treatment, which means that they may assume stereotypical narratives of non-binary patients based on these binary assumptions, and directly or indirectly use it to treat and diagnose them. Whether it's lack of medical training, implicit biases, or criminalized healthcare resources, the impacts are incredibly real and incredibly unsafe for trans and GNC people. Proper quality healthcare should be accessible to everyone, no matter their geographic locations, their beliefs, their identities, their orientations, etc. And this healthcare accessibility should not just change because of who someone is. For example, some efforts to improve GNC healthcare access, improving medical training, making it more inclusive of people from all backgrounds, anti-implicit bias training, political and legal efforts. The Affordable Care Act states the prohibition of discrimination based on sex or gender. Increasing the number of LGBTQ+ health clinics across the country, provides some community aid and peer support groups that aren't provided as much at privatized healthcare centers. And then public health research, informing policies and best possible practices, because there's an erasure of GNC and queer public health research. So, proper quality healthcare should be accessible to everyone, no matter their geographic location, beliefs, identities, orientations, etc. And this healthcare accessibility should not just change because of who someone is. The declining amount of trans and non-binary healthcare in the US specifically has already impacted thousands of people, and it's probably inevitable that it will get worse. What matters is that the inhabitants of the US can fight against the attack of trans and GNC healthcare resources. In short, quality healthcare for trans and gender nonconforming people in the United States remains severely inadequate. Despite growing awareness, systemic barriers ranging from provider bias and a lack of training to discriminatory policies, they persist in denying equal access or equitable access. Until the healthcare system welcomes inclusive education, institutional change, and patient care, trans and GNC populations everywhere will remain overlooked, underserved, and constantly at risk.